Hello friends. During an antenatal ultrasound scan, if the stomach is not visualized, you should rescan the patient after 20 minutes and see if it reappears. After 20 minutes, if it does not appear, then it is a reason for concern. So what causes non-visualization of the stomach or a small stomach? Well, there are a few reasons for it, and I will be reviewing it today from the book Requisites of Ultrasound. In this image taken from the book Requisites, you can see the arrow pointing towards where the stomach should normally be present. Also note that there is a large amount of fluid anterior to the fetus. This is polyhydramnios. When there is non-visualization of the stomach and polyhydramnios, the reason for the absent stomach is esophageal atresia. Esophageal atresia is when the esophagus ends as a blind tube and does not open into the stomach. As the amniotic fluid cannot get into the stomach from the esophagus, the stomach is not visualized. This is another image of the same fetus in the left sagittal position, showing the absence of stomach bubble in the left upper quadrant. In this image, you can see a small stomach bubble. Also note a large amount of fluid anterior to the fetus. This fetus had esophageal atresia with a tracheoesophageal fistula. The fluid got into the stomach via the fistula and not via the esophagus. This explains the visualization of a small stomach bubble. This is a different image of the same fetus with a small stomach bubble. Now there are a few other causes of non-visualization of the stomach other than esophageal atresia. In this image, you can see that there is no stomach bubble in the abdomen. The thorax looks a bit congested with a few cystic structures, but it's not very clear. When the same fetus was scanned in the transverse section, you can see that there is a stomach bubble present in the thorax and the heart is pushed towards the right. This is a case of diaphragmatic hernia with herniation of the abdominal contents, mainly the stomach, into the thorax. This is the image of a first trimester fetus with a small stomach bubble indicated by the arrow. This fetus had a large facial cleft that led to swallowing dysfunction and hence the small stomach bubble. This is the three-dimensional surface rendered image of the same fetus as in the previous image. You can see the large facial cleft involving the lip and the palate. So facial clefts can also be a cause of small stomach. This is another case of non-visualization of the stomach bubble on the transverse section of the abdomen. The head showed marked hydrocephalus of the frontal and the occipital horns of the lateral ventricle due to stenosis of the aqueduct. In this fetus, the swallowing could not take place due to the neurological dysfunction and hence non-visualization of the stomach. Another cause of non-visualization of stomach is oligohydramnios. In this example, you can see only a small pocket of fluid is present and the stomach is not visualized as there is almost no fluid for swallowing. So this sums up my video. Please like this video and subscribe to my channel, and inshallah I'll come up with more such content. Thank you.